Share-free Certified Documentation Integrity Practitioner, CDIP, exam questions for preparation. 1. A clinical documentation integrity practitioner, CDIP, generates a concurrent query and continues to follow retrospectively. However, the coder releases the bill before the query is answered. The CDIP wonders if it is appropriate to re-bill the account if the physician answers the query after the bill has dropped. Which policy should the hospital follow to avoid a compliance risk? A rebilling is permissible when queries are answered after the initial bill. B. A post-bill query rarely occurs as a result of an audit or other internal monitor. C. A second bill should not be submitted when the first bill was incomplete. D. A post-bill query is not appropriate when an error is found after an audit. Answer: A. 2. A clinical documentation integrity practitioner, CDIP, hired by an internal medicine clinic is creating policies governing written queries. What is an AHIMA best practice for these policies? A. Queries are limited to non-leading questions. B. Non-responses to written queries are grounds for discipline. C. Primary care physicians must answer written queries. D. Queries for illegible chart notes are unnecessary. Answer: A. 3. After 1 year, the Clinical Documentation Integrity (CDI) program has become stagnant, and the manager plans to reinvigorate the program to better reflect the CDI efforts in the organization. What can the manager do to ensure program success? A. Expand the CDI program to larger areas in outpatient clinics. B. Prioritize to focus on efforts with the largest return on investment. C. Identify key metrics to develop program measures for coders. D. Establish a CDI steering committee to build a strong foundation. Answer: D. 4. The Clinical Documentation Integrity (CDI) team in a hospital is initiating a project to change the unacceptable documentation behaviors of some physicians. What strategy should be part of a project aimed at improving these behaviors? A. Expand use of coding queries by CDI team. B. Add a physician advisor, champion to the CDI team. C. Encourage physician-nurse cooperation. D. Alter the physician documentation requirements. Answer: B. 5. A hospital administrator wants to initiate a clinical documentation integrity (CDI) program and has developed a steering committee to identify performance metrics. The CDI manager expects to use a case mix index as one of the metrics. Which other metric will need to be measured? A. Comparison of risk of mortality with diagnostic-related group capture rates. B. Assessment of APR-DRGs with capture of CC or MCC. C. Comparison of severity of illness with the CC capture rates. D. Assessment of CC, MCC capture rates. Answer: D. 6. The Clinical Documentation Integrity (CDI) manager is meeting with a steering committee to discuss the adoption of a new CDI program. The plan is to use Case Mix Index (CMI) as a metric of CDI performance. How will this metric be measured? A. Overtime with a focus on high relative weight (RW) procedures that impact these procedures on overall CMI. B. Over time with a focus on particular documentation improvement areas in addition to the overall CMI. C. Month to month and focus on patient volumes to determine the overall CMI. D. Month to month to show CMI variability as a barometer of a specific month. Answer B. 7. A hospital clinical documentation integrity CDI director suspects physicians are overusing electronic copy and paste in patient records, a practice that increases the risk of fraudulent insurance billings. A documentation integrity project may be needed. What is the first step the CDI director should take? A. Recommend the physicians to be involved in the project. B. Bring together a team of physicians and informatics specialists. C. Alert senior leadership to the record documentation problem. D. Gather data on the incidence of inaccurate record documentation. Answer D. 8. A clinical documentation integrity practitioner CDIP must determine the present on admission POA status of a stage 4 sacral decubitus ulcer documented in the discharge summary. What is the first step that should be taken? A. Look for wound care documentation. B. Read the nursing admission notes. C. Query the attending provider. D. Review the history and physical. Answer D. 9. A clinical documentation integrity practitioner CDIP is reviewing an outpatient surgical chart. The patient underwent a laparoscopic appendectomy for acute gangrenous appendicitis. Which coding reference should be used for coding advice on correct assignment of the procedure code for proper ambulatory payment classification, APC, reimbursement? A. The Merck Manual. BAHA Coding Clinic for ICD-10CM, PCs. COAMA Captain Assistant. DOICD-10CM, PCS Codebook. Answer C. 10. In order to best demonstrate the impact of clinical documentation on severity of illness and risk of mortality, which of the following examples is the most effective for physicians in a hospital? A. The latest Medicare provider and analysis review data. B. Emphasize the Medicare requirements for documentation. C. Examples from the hospital's actual cases. D. Explanations on how severity of illness and risk of mortality impact reimbursement. Answer C.